Hello everyone. We're going to take the next 15 minutes or so discussing beta-lactam antibiotics. This is a very important topic because these medications are one of the most commonly prescribed drugs overall, not only in the antibiotic group, but in general. We will discuss briefly their structure. I'm not going to get into chemistry much, but it's important to know their structure and their mechanism of action as it relates to its chemical composition. We're going to group them into different functional groups to understand prescribing practices and spectrum of activity especially. And at the end, we're going to talk about the overall safety profile and some examples of common syndromes in which we use beta-lactams and how those are treated. So let's start with structure. The first thing that needs to be mentioned here is that all members of this group of antibiotics share a common chemical ring called the beta-lactam ring. Here in this graph, you can see an example of a penicillin and a cephalosporin, both sharing that same structure called the beta-lactam ring. Very important for its function, and it's also going to be critical when we discuss mechanisms of resistance in a subsequent video. So let's talk about the mechanism of actions of beta-lactam antibiotics. They generally are bactericidal. They kill the targeted bacteria by inhibiting its growth. The beta-lactam antibiotic will inactivate enzymes that are essential for the cell wall synthesis, both of gram-negatives and gram-positive organisms. There are several different groups of enzymes that can be inhibited by beta-lactams, and in general these enzymes are called penicillin binding proteins, also called PBPs, and this is going to be very important when we discuss resistance, especially when we talk about Staphylococcus aureus and MRSA. In this graph here you can see both types of bacteria, both gram-negative and gram-positive, and the purple structure there is called a peptidoglycan. That's the structure that will be inhibited by beta-lactams. As you can see, gram-positive have a very large cell wall composed of several layers of peptidoglycan, whereas in gram-negatives there's only one layer. However, beta-lactams are active to both gram-negatives and gram-positives. So that's the essence of the mechanism of action of the beta-lactams. Let's now discuss the groups that we can subdivide these drugs. It's just a simple way to facilitate the understanding and prescribing practices of beta-lactams. And we can divide those into 4, maybe 5 groups of beta-lactams, and we're going to discuss those in detail. First, let's talk about the penicillins. These are the most commonly used antibiotics in pediatrics, and generally they can be subdivided into 4 different groups. The first one is penicillin per se. It's the natural penicillins. This is the one that was discovered by Alexander Fleming in the year 1928. These can be divided into penicillin G, is the one we give IV, and that's used mostly for patients that are admitted to a hospital that require IV therapy to treat streptococcal infections, for example, group B strep in newborns. Patients with congenital syphilis, for example, also are treated with penicillin G. The other forms are benzathine penicillin and PenVK, which is the oral form, used also for group A streptococcal pharyngitis. The second group in the penicillins are called the aminopenicillins. These are essentially your amoxicillin and ampicillin. These are antibiotics that have a longer half-life, so it can be given less frequent than the penicillins, and they are better tolerated orally. The third group are the anti-staphylococcal penicillins, and those include nafcillin, oxacillin, and Methicillin, for example, are all in this group. Very important, this antibiotic is called anti-staphylococcus because it is stable against the penicillinase, and it kills MSSA very effectively. These are the drug of choice for MSSA, but not MRSA. It's very important to remember that these antibiotics are not effective against the methicillin-resistant strains of Staphylococcus aureus. The fourth category in the penicillins are the anti-pseudomonal penicillins, or also called extended spectrum penicillins. These antibiotics have a very broad spectrum of activity, including Enterobacteriaceae, like Enterobacter, Klebsiella, and also Pseudomonas, and that's why these are called anti-pseudomonals. In this category, we have piperacillin. There are others in this category, but piperacillin is, I think, the one that you should remember is the one we use the most. Again, like I mentioned before, we can treat Enterobacteriaceae like Enterobacter, Klebsiella, and Pseudomonas with these antibiotics. Important to point out that these antimicrobials do not have activity against MSSA, and for that reason, it was combined with a beta-lactamase inhibitor called tazobactam. And that combination, also called SOSIN, has activity against MSSA. I'd like to point out that tazobactam is a beta-lactamase inhibitor, but there are others that can be combined with the previous antibiotics we've discussed, and that includes clavulanic acid and sulbactam. Those compounds are beta-lactamase inhibitors and overcome some mechanisms of resistance of the bacteria against beta-lactams. Let's go to the next category of beta-lactams. So we started with the penicillins, and now let's talk about the cephalosporins. I'm going to make a table here to make it easier for you to understand the classification of cephalosporins. They are classified by generations, and let's start with first generation. The ones that I would recommend that you learn very well are cefazolin and cefalexin. There are a few other first generation cephalosporins, but I think if you stick with these two, you'll learn essentially what you need for the first generations. These are very effective antibiotics against MSSA. Some E. coli can be susceptible to these antibiotics, and some other gram-negatives. But as you're going to see, as you increase the generation, the gram-negative spectrum improves. Moving on, the second generation cephalosporins. These are antibiotics that are not used very widely or very commonly. I'm just going to mention a few examples. First, cefuroxime is one antibiotic that's used mainly for surgical prophylaxis, or if you want better gram-negative activity against some beta-lactamase producing gram-negatives, and some anaerobic coverage you can get with this generation. The third generation cephalosporins are very important, and the ones you need to learn include ceftriaxone, of course, that's very commonly used for sepsis and meningitis and other syndromes. Cefotaxime, usually reserved for the newborns. Ceftazidime with anti-pseudomonal activity. That's going to be very important to remember about this one. So you do have activity against Pseudomonas in the third generation category with only this one. There are no other third generation cephalosporins with activity against Pseudomonas. Those three are IV, and then we go to the PO version of third generations, and that includes cefdinir. There are others, cefpodoxime, for example, or cefixime, but they all have about the same spectrum of activity. These antibiotics, especially the IV forms, penetrate the CNS very well. I'd like to point out here that the first generation cephalosporins, here in this category, do not have good CNS penetration. Next, we're going to discuss the fourth generation cephalosporins. And in this category, I'm going to discuss only one antibiotic, and it's called cefepime. This antibiotic is very useful because it has good activity against Pseudomonas and has very good stability against the beta-lactamase producing organisms. So it has good activity against enteric gram-negatives, including, again, your Enterobacter, Klebsiella, and Pseudomonas. This is a very good choice for patients with fever and neutropenia, for example. And last but not least, we have the fifth generation cephalosporin, which is a relatively new antibiotic with activity against MRSA. This antibiotic is the only beta-lactam that has activity against MRSA. That's very important to mention. There are no other beta-lactams with activity against methicillin-resistant Staphylococcus aureus. All these antibiotics from third, fourth, and fifth generation have very good activity in the CNS. So let's move on and talk about the third category of beta-lactams, and that's the carbapenems. These antibiotics have a very broad spectrum of activity. They're very good against anaerobes and against gram-negatives, and they do have activity against MSSA as well. In this category, we find meropenem and ertapenem. Those are the only two that I will focus on. Of course, there are others, including imipenem and doripenem, but those are not used very commonly in pediatrics. These antibiotics are reserved for patients that require their use. So, for example, patients that have intra-abdominal infections or infections secondary to anaerobes or polymicrobial infections. Meropenem has activity against Pseudomonas and again Enterobacteriaceae and anaerobes. Ertapenem has the same spectrum of activity as meropenem with the exception of Pseudomonas. So keep in mind, ertapenem does not cover Pseudomonas aeruginosa. What's very important to point out here is that these antibiotics are the drug of choice for ESBL producing organisms, especially in the setting of sepsis and bloodstream infections. And the fourth category that I'm going to discuss today in the beta-lactam group of antibiotics are the monobactams. And there's only one example of these antibiotics, and that is called aztreonam. This medication comes very handy in patients that have gram-negative infections. This antibiotic has the similar spectrum of activity as third-generation cephalosporins, with the exception of gram-positives. The aztreonam is not very good for gram-positives and should not be used as empiric therapy for patients in whom you suspect Streptococcus pneumonia, for example, or pneumococcus. And that includes other streptococcal bacteria. So keep in mind that you should probably choose a third-generation cephalosporin in those instances. Also important to point out is that aztreonam is a good choice for patients who have allergies against penicillin. Because of this chemical structure, aztreonam does not share many of the sites that can cause allergies. Well, there you have it. That's the beta-lactams, its mechanism of activity, the groups, and some examples of this very important and useful group of antibiotics. So I will leave it there. So if you have any feedback or comments about this video, please let me know. Thank you very much for your attention.